Our next presenter is a little video by the Special Rapporteur on the Right to Health, Dr. Tlaleng Mofokeng, also known as Dr. T, who is the Special Rapporteur on the Right to Health at the United Nations Human Rights Office. And we'll hear a video now. Thank you.
Dear friends, dear colleagues and siblings, thank you so much for inviting me to give you a few words to mark the Sydney World Pride. I am so excited to be able to join you, even though it's via video, at this largest LGBTQIA+ human rights conference, which is the biggest to be held in the Southern Hemisphere. Particularly proud myself as a person who comes from the so-called Global South. And as the Special Rapporteur on the Right to Health, I have firmly asserted from my very first thematic report outlining the strategic priorities of my work that sexual and reproductive health are integral elements of my work and the approach to my mandate, and that the issues of LGBTQIA+ are human rights. And even though many obstacles lie between individuals and their enjoyment of sexual and reproductive health, compounded by the difficult legal frameworks that many of us are living under, it is important for me to let you all know that I continue to work as a mandate holder to ensure that these interrelated and entrenched obstacles are alleviated. Very aware, of course, that many operate at different levels. For example, at a clinical level, being a doctor myself, I know firsthand some of the difficulties that LGBTQA+ people experience at the level of care as rights holders. We know that also there are obstacles at the level of health systems in terms of policy, but also the legal frameworks. And of course, in the underlying determinants of health, such as housing, access to food, housing and education, for example. And so it's important for me when I took on the mandate of the right to health, thinking very intentionally about sexual and reproductive health rights, but also LGBTQA+ rights in terms of the right to health framework, that the key principles that drive me of non-discrimination, equality, privacy, integrity, autonomy, centering dignity of people and well-being of individuals is really, really important, and it's integral in the realization of the right to health. And those principles for me are non-negotiable, and this is why these issues are human rights issues fundamentally. Even though we live right now in the context globally of rising anti-human rights ideologies, anti-trans ideologies, anti-LGBTQIA+ ideologies, and how during the pandemic there were emergency measures that were resulting in amendments to laws and social contracts that were directing the movement of people, for example. But there have also been opportunistic uses of these circumstances to implement draconian measures that further curtail human rights of LGBTQIA+ individuals. And I mentioned also in my report to the Human Rights Council that looked at violence and its impact on the right to health, but also looking at the impact of COVID on sexual and reproductive health rights, that in fact some regulations and some amendments require us to pay particular attention in the ways that enabled also resources to be diverted from important services for sexual and reproductive health rights, but that particularly meant that LGBTQIA+ persons, when unable to access hormonal therapy, for example, were unable to access safe abortion, for example, and that efforts towards decriminalization of same-sex relations in many countries have actually halted. But we also know that in many countries around the world currently, in spite of the rising anti-human rights, anti-LGBTQIA+ rights, but particularly anti-trans rights, we know that many countries are doing the right thing. They are putting human rights first, and that they are actually embarking on legislative processes that are geared to protecting human rights of LGBTQIA+ people. And so when we look back at the pandemic, I think there is still a lot to answer for. Although the pandemic is brutal, it was unexpected, there were many opportunities to do the right things the right way and truly put human beings first. And yet within all countries, marginalized individuals were pushed even more to the margins and continue to be confronted with greater barriers to sexual and reproductive health rights. And we know that LGBTIQ plus individuals continue to confront a compounding barrier. And in light of the Sydney Pride, I thought maybe to focus a little bit on the youth and the younger people whom often are experiencing unprecedented violence, both online and offline spaces, in real life spaces, the constant punching down on the youth particularly. It's something of concern. And adolescents have a right to express their views on all matters related to their own health and wellness, and especially sexuality. They have a right to access a free, confidential, and adolescent-responsive sexual and reproductive health services that give information around sexual orientation, sexual identity, gender identity and expression, and that, for example, respect for comprehensive sexuality education should be part of structured learning for both youth in school and youth outside of school. And so when we think about pride, as we think about the youth as an age, as a risk factor for vulnerability, we ought to really be taking steps to assist them, but to also demand that states overcome barriers of stigma attached to adolescents and their health in general, but also adolescents with regards to LGBTQIA plus needs. Of course, I continue to talk about and recommend very clearly that there should be no barriers, no abusive requirements as prerequisites for changing of name or legal sex or gender marker, and that medical procedures related to gender affirming care must be comprehensive and respectful. And even though the pandemic deepened the cracks that were already happening within the health systems, we have an opportunity right now through innovation, through agility, to really demonstrate the ability of the delivery of healthcare that is respectful, that is upholding human rights. And as much as policy changes during the emergency of the pandemic often become incorporated in long-standing non-emergency law, it is very critical for us to really look at those policy changes in our own regions, in our national context, sub-national context, in the regional context, and examine their impact on equality and equitable access to sexual and reproductive health rights moving forward. And I want to just also take a moment to reflect on the incredible work that is done by civil society organizations, activists and advocates, equally, and scholars, in how you are a change agent. And I continue to use my voice and the spaces I occupy of influence, even though transient, being in this position, in that trustful partnerships between governments, government agencies, state-run healthcare services, the nonprofit sector, philanthropy, that these trustful partnerships constitute one of the cornerstones of effective health systems. And they act as a guarantee for the effective realization of health-related human rights. And I continue to call out global health institutions of global governance as well, that limit the space of civil society to be meaningful participants on matters that affect them, at the global space, at the regional space, as well as the national spaces. We have to continue to see pride as an act of resistance, of insistence, and of persistence. Our very lives depend on it. Pride is not just about celebration of resistance or resilience. It's not just about survival. And states must understand that they must respect and protect human rights. They must employ key principles of non-discrimination, equality, and privacy, as well upholding integrity, autonomy, and dignity of all people. And I dedicate my tenure to continue to create a life of dignity for all people, especially people living in the margins, especially for you, my siblings. And I want to thank you again for this opportunity to be able to address you as you gather for the largest conference in the Southern Hemisphere. And I wish you well, I wish you a life of dignity, and I wish you a life and a society that is conducive for you to create a life that you can thrive, a life of dignity.